In Canada, we are so lucky to have the highest access to fresh water on Earth. Most of us have never had to worry about the water coming out of our taps or the proper disposal of our sewage. These services are something we take for granted and something we should learn to appreciate, because not too long ago, in the mid-1800s, the outbreak of typhoid led to the deaths of thousands, if not millions, of people.
During the time that cholera was originally spread, John Snow was able to link the spread of these diseases through contaminated water pumps in the village. This is exactly like the spread of typhoid. Both of these diseases were spread through water, and both had to do with the contaminated fecal matter in water. The symptoms of both cholera and typhoid are very similar, and they are both of a bacterial vector, meaning that they are spread through usually food, water, and occasionally contact. Both these diseases were spread through certain social determinants of health, such as poor sanitation, a lack of clean drinking water, and other poor related living conditions. Community without proper sewage systems seem to suffer the most from these epidemics. The symptoms between typhoid and cholera are also similar, with the main onset symptoms including high fever, diarrhea, nausea, and vomiting, causing the body to be severely dehydrated.
There are many similarities between today's modern COVID-19 vaccine and the vaccines that were prescribed back in the mid-1800s. The typhoid vaccine was made from culturing the typhoid bacteria, then denaturing it using a heated water bath, and then diluting heat-killed bacteria solutions to achieve the right vaccine dosage. This process used to weaken the virus/bacteria to allow antibodies to strengthen and kill it off. Present-day vaccines are created not just this way, but multiple ways, including DNA vaccines, mRNA vaccines, and inactivating the virus.
Precautions, wash my hands after the toilet and all that, before meals and after. There's nothing else you can do. If you catch it, you catch it. There's nothing else you can do. Oh well, I suppose you catch it, but it's better to take precautions now. It's better now.
In the summer of 1964, an outbreak of typhoid caused the town of Aberdeen to enter into quarantine. Patients who showed even the slightest symptoms were restricted to their houses for days on end. Parents of infected children could only visit their kids through the windows of hospitals. Travel into and out of the city was closely monitored by officials. We can see lots of parallels between the quarantining, travel restrictions, and hospital policies of COVID-19. The effects of pandemics and spreads of infectious diseases on the general population seems to reap a generally similar reaction from the public, and society's response to these epidemics, including quarantine and increased restrictions, seems to be an accepted course of action. Typhoid remains a major threat in many parts of the world because of certain social determinants of health, such as lack of access to safe drinking water, ineffective sewage systems, and lack of affordable health care. Many communities are suffering. Even in the case of typhoid, poor, low-lying areas of Oxford, shaded pink here, without effective sewage and safe drinking water, suffered many deaths from these enteric diseases like typhoid and cholera.
The COVID-19 pandemic has exposed the long-standing structural drivers of health inequalities, such as precarious and adverse working conditions, growing economic disparities, and anti-democratic political processes and institutions. These important determinants of health have interlinked with class, ethnicity, gender, education level, and other factors during COVID-19 to exacerbate existing social vulnerabilities in society. These same standards existed in the times of both cholera and typhoid, and unfortunately, it seems as if they will always exist. As much as we can try to support undeserved communities with access to healthcare, proper education, and other social determinants of health, there will always be an affected and marginalized group that suffers more greatly from the effects of disease.
Despite over 150 years of control efforts, typhoid still infects over 11 million people, of whom over 100,000 die every year. Worrying, typhoid is also becoming resistant to antibiotics due to treat it, much like COVID is mutating and adapting to become resistant to vaccines. A current mass outbreak of typhoid in Pakistan is untreatable with all but one of the affordable antibiotics. We are seeking a real disconnect between the first, second, and third world and the treatment of disease. The lack of access in poorer countries means that the overall spread and detrimental effects of these diseases is significantly greater. Thankfully, this new typhoid conjugate vaccine has been tested in Oxford. This and increasing global access to safe water and health systems are crucial ways to tackle and eradicate typhoid once and for all.